Hey guys, this is Dr. Martin again answering more questions. We always get the question of what kind of lifts can I have done? Well, there's many different types of lifts, but the three main lifts done in our practice are a Benelli lift or a donut lift, where that incision goes just around the nipple areola complex, versus a lollipop lift, which goes around the nipple areola complex and down the front of the breast, versus a wise pattern or anchor incision implant or mastopexy, which goes around the nipple areola complex, down the front of the breast, and in the full below. Which one do you need? Well, it all depends on where you're at. So if your nipples are at your knees, you're probably going to need more of a lift, and so that's probably going to be more of an anchor lift. If you need just a touch of a lift, it may be the donut lift, because that's less of an incision. So we always base it on what you have going on, and if you're doing an implant, what would the implant provide in the lift procedure? But we always prepare you mentally for the anchor incision. That allows us to do as much as we can in the operating room without being handcuffed. So we'll place the incision, we'll go down, we'll place the implant typically in a submuscular plane, and then while you're asleep, we'll sit you up on the table and figure out what kind of pattern that you need to get you the best lift provided. So that is the mastopexy procedure. Love them to death, with or without an implant, depending on what the patient wants. So come in and see us and we'll get one done for you. Okay, so we're talking about recovery for a breast lift procedure, what to expect afterwards. Well, because we're using many different components to not only help with scarring, help with pain, help with all those types of things, you're probably in about once a week. So if you're looking at a timeline, you'd be in the first week to just do a general check after the procedure and make sure your oxygen dressing is doing well. Second week is exactly the same procedure, make sure your oxygen dressing is doing well, not having any problems. The third week you come in, we're going to take the oxygen dressing down, also take the prenio down, and the prenio is the component that's holding the incisions together. That's the Steri-Strip on steroids to keep all those incisions together. We'll take that component off, and then in 4 weeks we're completely taking the oxygen dressing away from you and you don't have to use that any longer. When can you go back to the gym? If you could give me 4 to 6 weeks, that would be great. That allows the incision to heal as much as we can get it to heal and get you back on the road to recovery. So lots of time involvement, about 1 time a week, and back to the gym in about 4 to 6 weeks. Minor discomfort, 3 to 6 months, and you're ready to go.